Richard. Okay. All right. Don't move the space holders yet. Do a 30-second countdown. So we're ready on this side. We'll just give you about 30 seconds for your station IDs, and then you can come across. Good afternoon and welcome to the Opm Media Center here at the Office of the Prime Minister in Kingston, Jamaica. Prime Minister, the Most Honorable Andrew Holness, presided over several meetings of the Cabinet over the last week, including one today as well. As is his commitment, the Prime Minister will update all Jamaica on the deliberations and decisions relating to Jamaica's response to the Covid-19 pandemic. We were scheduled to start at 5:30. May I use this means to officially apologize? Of course, Cabinet was deliberating on some very weighty matters. Ladies and gentlemen, the Most Honorable Prime Minister of Jamaica, Andrew Holness.
Good afternoon, everyone. Let me welcome all who are listening in Jamaica, outside of Jamaica. I know that these press briefings have a large viewership, and for those who have been waiting, again, let me apologize, but as you can imagine, many of these decisions that we are about to announce have to be deliberated down to their finest points before we come to the public with them. I'm going to ask that the Minister of Health come up first and give us an update as to the actual health situation.
Thank you very much, Prime Minister. Colleagues, ladies and gentlemen, as of this afternoon, the number of confirmed COVID-19 cases has risen to 223. Included in those numbers are 27 new cases. Of those 27, 19 are females, 8 are males, and 26 of the new cases are linked to the Portmore workplace cluster. There are now 34 imported cases, 6 that are local transmission with no epidemiological link, 47 contacts of confirmed cases, and 136 that are under investigation. Of that 136, 120 have been identified within that workplace cluster in Portmore, in addition to 16 other cases. So far, 1,889 samples have been tested. 223 are positive, 1,655 are negative, and 11 are pending. In terms of isolation and recovery, there are 128 persons in isolation and 24 in quarantine in a government-operated facility. 27 persons have recovered, and unfortunately 5 persons have died. I want to just say raise two important points before the Prime Minister takes back the mic. Firstly, the issue around the workplace cluster we know will come up, and the Ministry of Health and Wellness has been working to address the concerns of citizens. I know the Prime Minister will elaborate more on this, but just to give some numbers, we have so far collected just over 600 samples from the just over 767 employees. We have also made contact with just over 300 persons who are connected to those employees, and have collected samples from over 200 of those. The process, of course, is ongoing. Of the number of samples that we have collected, up to yesterday, and I know there's some new numbers today, 200, just over 250 were actually tested, and we have received almost a 40% positive, which clearly indicates a significant spread within that particular workplace environment, very, very significant, which is partly the reason for the concerns in that area and in St. Catherine generally. The part of the challenge that we face, public health that is that these individuals who work within that cluster, that BPO cluster, are relatively young. They have intergenerational living arrangements. They live with their parents or their grandparents, and they are very mobile. As a consequence, the health authorities who are doing the contact tracing are challenged to keep them quarantined without the risk of spreading the virus to their family members and close contacts. And because of that, we have had to make some alternative arrangements, which you will elaborate on that, Prime Minister, which the Prime Minister will. Okay, fine. So over the last few days, the ministry, in discussions with the Prime Minister and other cabinet colleagues, took the decision that it would be better to extract these individuals from the environment in which they live, the communities in which they live, and to place them in a more controlled quarantine and isolation setting, depending on their particular status, whether they're positive or not, whether they're asymptomatic or not, whether they're ill or showing signs of major illness and require hospital care or not. That process has started today. We have secured, up to this point, some 500 rooms in 3 facilities, and the movement of those persons to those facilities where we can control the movement more significantly has commenced and will continue over the next few days. We believe that that is going to be the best approach to controlling the possibility of spread. The final point I'll raise from the public health side is that since March 14, we have had some 21 cases of COVID-19 that have emerged through our Sentinel Sites, persons with respiratory ailment or influenza-type symptoms. Now, what we do, we have treated our Sentinel Sites as a control group, in that these persons are not connected to travel history. They're not linked to contact tracing. They turn up at our health centers or hospitals, and they have symptoms, influenza, upper respiratory symptoms. We test them. Once they come in, we test them. And what we have discerned is that there is a growing number of those persons who are positive. This represents for us the first stages of community spread, which we had anticipated and spoken about some time ago. I close by saying it is therefore so important from the public health perspective that Jamaicans observe the guidelines that we have outlined, the issues around staying at home, the sanitizing of surfaces and personal hygiene, wearing the mask when you're in a public space, very, very critical. And also, if you have issues of concern, use the 888 One Love number to call so that we can provide additional information for your own interests, for the interests of your family members, and by extension, the community. Thank you, Prime Minister.
Thank you, Minister Tufton. So now we are at 223 cases. A week ago, we were somewhere in the region of about 70, 73, I believe. And you see how fast the numbers move. We always knew this would happen. We have always said that there will be a spike. Exactly how that spike would have come about, it would be hard to predict. But once you are in this phase of the epidemic, that is now the exponential increase in your numbers, then you have to take the appropriate measures. We have been very strategic in how we have handled our epidemic. The truth is that we have balanced lives and livelihood. The weekend is a demonstration of why it is that government policy has to balance lives and livelihood. Because our economy and our society is structured in such a way that if the government acts in an irrational, overbearing, harsh way, then people will suffer. The less fortunate, the vulnerable, those who are on the periphery of the society, they will suffer. And if they suffer, you could find a situation where they dispense with all reason and say, why should I withstand hunger and deprivation for the threat of a disease? Once that starts to enter into the calculus of the thinking of the average Jamaican, then all the measures that we try to put in place will be for naught. And we saw that when we put in place the measures for St. Catherine. It is not that people don't understand the threat of the disease. Yes, there are some who still don't understand and appreciate it. But when they take on a rational risk-based analysis, they decide that even with the threat of the disease, they will act in ways that could jeopardize not just their own health, but the health of the country. So the challenge that the government faces is always trying to put in place measures that will account for this kind of thinking and this kind of behavior. We spend a lot of time trying to bring on board the Jamaican society so that we all recognize that if we act responsibly, if we take faith in the guidelines issued by the government, and take faith as well that the government is listening to you, the government is not trying to act in any particular special interest. The government is acting in the national interest. Indeed, the government is acting in your interest. So once that is rooted and cemented in the minds of the people, then it makes our job that much easier. So we did very well, as I had said before, in having almost a month since the first case, keeping the numbers very low, extremely low. But one incident occurred, which is now under investigation, and there is a whole process around that. The result of that is that that one incident has yielded more cases than what previously existed. In other words, the entire island had, up until the outbreak, somewhere around 73, 75, don't quote me on the exact number. And now we are at 223, of which I believe about 122, of which 122 are from that single workplace. So you see the kind of infectiousness of the disease that we're dealing with. And I hope that the average Jamaican listening, the Jamaican who would say, nobody can tell me if it's on me yard. You know that Jamaican. That Jamaican who say, I've passed through tougher than this and I've survived. That Jamaican who say, a little white rum and some bush tea and I'm good. I'm hoping that also the Jamaican that say, well, I can't stay home and suffer, so even if I'm going to get the disease, may as well I get the disease. I'm hoping that those kinds of thinking will be dispensed with, will be put away, and a greater reasoning, a better reasoning, will come into effect for all our citizens. It is a real struggle for the cabinet to put together the measures. There is no one set of perfect measures, meaning there is no set of measures where everyone will feel that they have won. We try as best as we can. There is no set of measures that do not require of every single citizen some sacrifice. So what is it that we're trying to maximize with the measures? Well, firstly, those persons who are most at risk from dying from the disease, we want to protect them. And we know who these persons are. They are persons over 65 by the clinical profile of the effects of the disease. They are persons who have comorbidities, especially those who have multiple comorbidities, meaning that they have other illnesses. And Jamaica's health profile is such that non-communicable diseases are prevalent in our society, particularly your diabetes, some people say sugar, hypertension, high blood pressure, heart problems. So these highly prevalent diseases in our society, and with the age profile, would place a significant number of Jamaicans in that high-risk category. So strategy number one for the government is to ensure that that high-risk category stays out of harm's way. So it's the orders that are designed specifically, that speak specifically to those populations, are the orders that say if you're over 70, if you have comorbidities, if you are working and you have these kinds of illnesses, diseases, but even if you have them under control, still stay at home, stay indoors. We do make provisions for those elderly persons over 70 to come out once per day to get the essentials of life and go back in. But for your own protection and health, you should try as much as possible to stay away from the general population. Now, the government has also taken some other measures, which the Minister of Local Government had announced earlier. Golden age homes, infirmaries, there are certain orders that relate to them. Those orders still remain in place, particularly about visiting and how workers should operate and the hygiene measures that are necessary. So we want to make sure strategy number one is to protect our elderly. So far, knock on wood, we have done fairly well in protecting the elderly population and those, of course, with the high prevalent comorbidities. The second strategy is to have a very efficient and responsive surveillance system. So the entire public health system is on alert to pick up whenever we see a case comes to our attention, whether it turns up in a hospital, in a health center, or someone calls in. And I believe that the success that we have had to date is primarily due to the agility and high functioning of our public health services. And today, again, it can't be said too much. When we say public health services, we tend to specify doctors and nurses. We tend not to speak about the public health inspectors and those persons who do the contact tracing and who are really on the front line going out interviewing persons. And I want to today big them up and say, we recognize what you're doing and we salute you and we appreciate what you have done. So that system has worked very well along with the testing protocols. And I do know, I interview a few of the persons who work in the system. I interface with them, I talk with them. They explain to me what their job is. And I do know that they are out there on the front line. They're being sent all over the country, tracking down and tracing, interviewing. And it is a skill. It is a real skill to get people to cooperate and to disclose where they have been and who they have been in contact with, and then to do the matrix and make the connections. And as a result of that, we have been able to capture most of the cases. In fact, a significant number of the cases. In addition to that, those cases that have turned up in the system on their own, we have, as the minister said, the Sentinel Sites. Those are the sites where people would, if they feel ill, they would just go. And we have tested all those cases. And those cases give a very good indication of what is happening with the spread of the disease in the wider society. So if you find that people are turning up outside of your contact tracing, then it is a signal, it is a sign that the disease is generally coming up in the population now, and you could say it is community spread. I am not going to say that as yet. I will allow the CMO and the epidemiologists to say whether or not we are in community spread. But it is signaling that the virus is out and about, abroad, generally in the community. That means you could walk past someone and pick up the virus. That means you could be standing in line at the supermarket and pick up the virus. Indeed, I don't have permission from the health personnel to say this, but I'm going to say it in a general way for shock value, but it is true that one of the persons who was picked up as a close contact, when the public health officials made contact with the person, they were standing in line at a supermarket, answered their phone, and it was a public health official asking them, "Where are you?" "I'm in a supermarket." That is what is happening. So that is telling you that it is generally out there, and you have to be careful. So where we are now is that the Minister of Health and his team, in terms of another strategy, in the sense that we have done as much as we can in terms of our contact tracing and identifying. You have heard the minister say we have done contact tracing for 500 or more of the 700 plus workers. 600, you have done contact tracing for 600 plus of the 700 plus workers in that workplace. But a better measure would be to ensure that those who we have done the contact tracing on, those who we have knowledge of, that instead of having them generally quarantined in the area, it is better to have them quarantined together where there can be better administration and supervision and better analysis of what is happening with the outbreak in that cluster. So as the minister pointed out, they have taken a decision to move the affected population into quarantine. It is, I think, an excellent decision because it takes the burden off the Portmore community, the Linstead community, the St. Catherine community in general. Because as we would have seen, it is next to impossible to have a perfectly running curfew order, stay-at-home order, no movement order in the parish of St. Catherine. So having them in the parish heightens the risk of persons actually getting being infected with the virus. Nevertheless, we don't have all of them, and we don't know all the contacts that they would have made. So there is still a risk. So in the management of the risk, last week, this time, we decided to impose enhanced curfew measures on the parish of St. Catherine. Those enhanced measures were difficult for us to do because from the outset, we knew how difficult it would have been for a parish like St. Catherine, where you could easily say, I'm not speaking from statistical knowledge, but just anecdotally, maybe half of the working population of Kingston and St. Andrew lives in Portmore and St. Catherine generally. And you could almost say that 2/3 of the essential services workers live in St. Catherine and commute into Kingston and St. Andrew. So it was always a difficult task. But we calculated the risk and felt it was better to have done it. Why? Because though the measure has come under some criticism, and we understand why, my job is to explain the logic, and sometimes the logic escapes the criticism. So whilst we're not able to totally use, and I hesitate in using the term lockdown because there's no lockdown, but we were able to prevent people from going into Portmore. And I think that is half of the benefit. Since we can't prevent people totally from coming out, if there is a population moving in and you can stop that, I believe we have effectively stopped that in terms of a risk management. We have been effective as well in limiting the movement from St. Catherine into other parishes. There are a few areas which are not manned, and I have spoken with the Commissioner of Police to ensure that we step up those measures to ensure that there is a tighter restriction on movement out of the parish. The challenge, of course, with putting on the measure is that everybody wants to be exempted. And I know everybody is important, everybody's job is important, but the purpose of the measure is to stop movement. The virus doesn't have legs. It depends on us moving, and the more we move, the greater the probability of spreading the virus. So there is no absolute stopping of measure, but stopping of movement measure. But what you want to do is to manage the risk, and so you put in place measures that will have a large impact on movement. What happened in Portmore in particular, Spanish Town and Linstead to a lesser degree, was a defeat of that purpose on the days where movement was allowed. We have done some recalibration, which I will explain later on, to enhance the effectiveness of the measure. The other strategy that we employ in managing the epidemic is to manage movement generally in the society. And what we have done is to put in place general curfews. And again, I must commend the police and citizens in general for the high level of compliance regarding the national all-island curfews. Those have worked exceptionally well, and they have served to limit unnecessary movement. By 9 o'clock, the roads are generally clear. When it was 8 o'clock, generally the roads are clear. During the Easter, when we had more enhanced measures, generally the roads were clear. So I think Jamaicans have done well in that regard, and that gives me hope, and I think every Jamaican can take hope that we can follow some of these measures without complaint and without any form of disobedience. Now, those measures, as I've said, work. We have put in place other measures, such as the gathering rules. The gathering rules have been particularly difficult to implement because of how they are being interpreted. So supermarkets, for example, some supermarkets say they're only allowing in 10 at a time. The way in which the orders are structured, supermarkets are not exempt from following the social distancing rules. They are not exempt from the gathering rules, but they have to exercise certain latitude in how they allow in customers. So the idea is that if they have to come into the space, that you should put up what is called physical distancing markers. And you should insist that people stand, and we have done some amendments here, 6 feet apart within the space, and you should make a judgment on the number of persons within the space so that the number doesn't breach the 6 feet space for each person. And that's easy math for persons to do, and that should be a good guide as to how many you can let in at a time. And you also want to move people in and out quickly. So for people who have to shop, people who have to move about, you want to get in and move about. Leisurely shopping, window shopping in this time, not recommended. And indeed, the supermarkets and other public service agencies should try as best as possible to move people in and out. Now, we've also tried to encourage businesses to move their services online. What was clear on Saturday was that persons had to stand in long lines to get remittances. And it is not just remittances, it's to go generally with these measures to pay electricity bills, to pay utilities. Many of these services can be done online. And I want to encourage every single Jamaican who has a bank account, who has a card attached to that account, if you are not now using online services, and if you have never used it and you don't know how to use it, ask for advice, call the bank, and let them explain to you how it is done. Now is the time to get online, in every sense of the word. Get on the internet and get online with the measures that we are putting in place. The truth is that if all Jamaicans were banked, that is, that they had a bank account, then there would be no need, absolutely no need to go to a physical place to collect your money. And indeed, if all Jamaicans were digitally provisioned, meaning that they had a facility to go online and there were financial technology solutions that could allow for widespread payments, then there would be no need for many of the lines that we're seeing. So a part of this COVID epidemic is the transition of the society to a digital society. Indeed, hopefully, this will be one of the long-lasting changes that would result from this crisis. So all of those are measures that we have put in place, and I've given the explanation as to why we have those measures. So as of today, we're making some changes to the orders, and I wish to announce them now. Educational institutions are to remain closed up to the 31st of May, 2020. I want to be clear, I'm not saying that there will be no school. The physical place of learning, the school, will remain closed, but education will continue online or remotely. So they will remain closed until May 31st, 2020. Our borders will remain closed to the 31st of May, 2020. However, this will be subject to controlled re-entry of Jamaicans in accordance with established protocols. Previously, when we closed the border, we allowed limited re-entry via a discretionary application through to the Minister of National Security and then the approval of Cabinet. Now we will have a protocol in place. The protocol has been established, and that protocol will control the re-entry of Jamaicans. And here let me say that I am very sympathetic to the case of the Jamaicans overseas. I get a report almost daily from your Minister of Foreign Affairs, and I'm going to ask her, when I'm through with these measures, to come up and give an update. There are some who are more vocal than others, and I may see their case because they are more vocal than others. But I want every single Jamaican to understand that there are thousands of Jamaicans stranded all over the world, some of them in extreme hardship, not just financially, but psychologically and emotionally as well, being apart from their home. Jamaica is not the only country that has adopted strict border controls. Within the Caribbean, there are several countries, within CARICOM especially, who have taken that position. And it is for good reason. But my sympathy is with them, but more than sympathy, we have put in place a protocol. It would have to be discussed publicly, obviously. We will bring it to Parliament. And as soon as we can, we will start to have controlled re-entry. All BPOs are to be closed for a period of 14 days, starting at 1 second past midnight, or rather 1 second past midnight on the appropriate way to say it, AG, help me. It's Wednesday. Wednesday. So commencing on Wednesday. So on Wednesday, and Wednesday start at 1 second past midnight Tuesday. So from Wednesday, so they have 24 hours, basically 24 hours notice, to close their operations for a period of 14 days. Now, I want the country to understand that this was not an easy decision. The same people who will tell you that you must close the BPO are the same people who will quarrel with you and say, people who used to work in the BPO are starving and you're not providing for them. Again, there is no easy solution. Closing the BPOs either is not a simple or absolute action. unless you intended to close them for good and forever, because these operations are not meant to be closed. They are meant to give you 24-hour stand-up services through hurricane, natural disaster, catastrophe. That is how they are designed. So, for example, they have critical systems that can't go down because these servers serve critical industry and infrastructure that Jamaicans depend on. Many of them provide support to logistics and shipping that brings the food into our country. Many of them support the telecommunications and banking industry, that were those to go down, then you would not only see the lines of people who can't get their funds at the remittance office. You would also see those who stayed at home trying to get their money online, quarreling with you. So the issue of closure then is that we have said to the BPOs that the critical services, those that support the telecommunications, the banking, and the logistics and shipping, particularly those related to our operations as a country, that we will make exemptions and provisions for their operations, but those will be closely regulated. In fact, we are going to appoint one of our agencies along with the Ministry of Health to closely examine those minimum operations, because we don't want that minimum operation to be used as a guise for full operation. I am heartened by the level of proactivity that I see within the Business Process Industry Association. They have already started to plan. Indeed, many of them expected that this move would have occurred. And they have moved close to 13,000 of their workers to work from home. And the government earlier had made a provision to allow BPOs to move their equipment from the workplace to the place of home. And so many of our BPOs had already taken advantage of that. It is not easy on them. There are significant costs, but I believe everybody understands that this has to be done. This measure has some public health considerations as well. Consider if there were to be another outbreak in another BPO, God forbid. We see the level of infectiousness of the disease and how quickly it spreads in high concentrated workplaces in closed environments. So though the measure is specifically related to BPOs, I have asked a set of ministers to start looking at their operations and advise as to what other industries and areas would need to have special regulations that meet that criteria. They are in a closed environment, concentrated number of workers, and they are working in close proximity. So there are many businesses like that. I won't call any names or sectors at this point, but you can imagine some of them. And so we are going to be putting in place regulations very quickly. So it would help if businesses self-identify and immediately put in place measures before the government does it. So consider this as notice. We look forward to the reopening of the BPOs, but under different conditions, obviously. We don't want to lose the livelihoods that the BPOs support. But at this time, the health of the nation takes priority. The work from home orders are extended for a further 14 days. So employers have a duty to examine their business process, see what can be done remotely, what can be done at home, and adjust those accordingly. The stay-at-home orders are extended for a further 14 days, and of course we know what the stay-at-home orders are. If you have no necessary business on the road, stay at home. If you are 70 years and over, stay at home. If you are ill with respiratory or flu-like symptoms, stay at home. If you have nothing to do, tana your yard, stay at home. But let me clarify, the stay-at-home order has some specific things to it. If you are ill with respiratory symptoms or flu-like symptoms, stay indoors. Isolate yourself from the rest of your household. Make contact with the health services and follow the provisions to get to the health services. Wear your mask, stay away from crowds, try and arrange transportation that will get you for treatment. We have examined the curfews, and as I've said, they have worked very well. But given the phase that we are in and the potential now of community spread, we believe that we have to tighten the curfews. I had kind of relaxed them after Easter, but the cabinet considered it carefully, and on the advice of the security forces and the health considerations from the Ministry of Health, we have some new curfew hours, nationally, island-wide. So for the next 14 days, the curfews will start at 6 p.m. and end at 6 a.m. I see Minister Tufton saying 5 because he wants to go and jog at your home. Jog at your home. And that's you know, this is the challenge. So exercise is a perfectly good activity. But is there a way that the society can reorganize how it exercises without being exposed to a lot of people running up the hill or running around the dam or going to gyms? Is there another way in which we can do it? Is this one of the sacrifices that we would have to make in order not to have the spread of the disease? And this is what we're saying. There is no solution that doesn't require some form of sacrifice. So it is 6 p.m. to 6 a.m., and this will start as of tomorrow for the next 14 days. Now, we have made some adjustments to the curfews as well. Work hours are now adjusted. So work hours are from 8 a.m. to 4 p.m. So curfews are from 6 a.m. to 6 p.m., 8 a.m. to 4 p.m. It means that you have what is called travel time. So travel time is from 6 a.m. to 8 a.m. and from 4 p.m. to 6 p.m. The JUTC and registered PPP taxes, PPV taxes, public passenger vehicles, they are allowed to be on the road from 5 a.m. to 7 p.m. But they must not have any passenger in their cars between 5 a.m. and 6 a.m. and 6 p.m. and 7 p.m. That is their transportation time back to their home. So the JUTC driver, he needs to get that bus back into the depot and find his way home. The taxi man, after he has dropped home the last person, he needs to find his way back home. So I believe that that is very clear and very fair. So we are asking, therefore, that all workplaces make the necessary adjustments. If you are on the exempt list, and we will clarify that tomorrow. So, for example, a power station, that has to continue to operate, but it should not necessarily need all its staff. So the staff that is not critical to the operation, that's a 24-hour operation, their duties should end and they should go home by 4 p.m. This measure applies to supermarkets. The supermarkets, however, should close at 5 p.m. The pharmacies should close at 5 p.m. The corner shops should close at 5 p.m. And we're doing that to allow that extra time if you need to drop in and pick something up. We have adjusted the times for markets, and the markets will now, instead of being closed at 2 p.m. and it was Sunday, Monday, Tuesday, and Wednesday, we will now allow the markets to open all week, except on Sunday, up to 4 p.m. So the markets will go from 6 to 4. They will be closed on Sundays. So there will be one day without any market opening at all. Wearing of masks. The wearing of masks is now mandatory in all public places, and that would include passenger vehicles. All public passenger vehicles. I am encouraging all Jamaicans to comply, because we are now in the phase, or the CMO will explain whether or not we are in the phase, but we are close to being in that phase of community spread. The prohibition on gathering continues and will be extended for a further 14 days. No gathering should exceed 10 persons. Social distances, the orders for social distances are modified. We had given 3 feet minimum that people should stay. The minimum is now 6 feet. And these are orders which we intend to enforce, and we are asking all Jamaicans to note that. I know it's hard to stay away from someone. We are people who are used to being close to each other and embracing. But in this epidemic, I urge you to stay 6 feet apart. The exemption lists remain. Tomorrow we will go to Parliament and we will have a review, a debate on these measures, so we could make changes to the exemption list. I must say I'm not inclined to see an expansion of the exemption list, but we can certainly clarify the exemption list. For St. Catherine, the measures announced in relation to the borders of St. Catherine remain. So St. Catherine is under a 24-hour curfew, technically. There are exemptions for the exempted list of essential services and essential businesses that can continue to move about, to pursue their duties or to pursue the services that they give to the public. But the days for movement and the time for movement has been adjusted. On Wednesday, so tomorrow, the existing order for St. Catherine will expire. These new measures will take effect on Wednesday. So on Wednesday will be what we call a shopping day. And residents in St. Catherine will be able to move about on the hours of the national curfew. So they will be able to move about from 6 a.m. to 6 p.m. However, the establishments that are permitted to open, which continues from the existing orders, they will open from 8 a.m. to 4 p.m. We have removed the alphabetic classification for movement, so everyone can move around on that day. But put it here this way, if I lived in St. Catherine, I would explore every means possible not to move. I have family that lives in St. Catherine, very close family. Still, my mother lives in St. Catherine. And my advice to her, stay home. And I'm giving all mothers in St. Catherine that advice. Thursday is a stocking day. So after everybody has taken out all the groceries out of the stores, then on Thursday, the stores are not open to the public, but they are open for restocking. So Thursday is a no movement day, except for essential services who are permitted to move. But stores can open for restocking, but they cannot serve the public. Friday and Saturday are shopping days. Same rules apply. You can leave your home at 6 a.m., spend 2 hours getting to where you have to go. 8 a.m. the stores will open, and then by 4 p.m. they will close, and then you spend 2 hours to 6 p.m. getting back home. Sunday is a no movement day, and we will allow restocking. Monday is a shopping day, because after Friday and Saturday, there should be no stocks left. So you have to restock on Sunday, in order that Monday is a shopping day under the same conditions And then stores can restock if they so choose on Tuesday, but remember, Tuesday would be a no movement day for citizens. These will be published so that all citizens in St. Catherine can understand how this will work. Pharmacies are allowed to remain open throughout the period of the measures. So pharmacies can open from Wednesday to Tuesday. However, on the no movement days, they are only permitted to dispense pharmaceuticals for good reason. There are many pharmacies that are mini-marts and sell other things other than medicine. It would defeat the purpose. So this is to ensure that persons who are ill can get access to the essentials of life. As I said, there is no perfect solution. We try to come as close as possible to the solution. Bars, amusement places, and the likes remain closed. These orders will be gazetted after debate tomorrow, and they will be published in the usual form. I'm going to ask Minister Johnson Smith to...
The curfew actually starts on the 22nd. He said tomorrow it starts at 6 p.m.
Yes, I will clarify, yes. The new curfew rules, the AG is reminding me, starts on the 22nd. So at, AG, you're saying at 6 p.m. or at 6 a.m. on the 22nd? The new curfew rules, precisely, the new curfew rules, forgive me, starts 6 p.m. on the 22nd. So you have 1 day's notice effectively to the start of the new curfew rules, which would mean that all the other measures under those rules follow, which is the closing times for businesses from 8 a.m. to 4 p.m. and the traveling times for persons in public transportation and the closing times for stores would start at that point in time. So, ladies and gentlemen, thank you for listening. I'll ask the Minister of Foreign Affairs to give us an update as to our Jamaicans overseas and the measures we are taking to assist them. Minister Johnson Smith.
Thank you, Prime Minister. I know this is a matter of great concern to not only Jamaicans overseas, but to those of us here with not only friends and family who we miss dearly, but just Jamaicans who have a strong sense of our diaspora community and our brothers and sisters who have found themselves in a range of circumstances overseas when they had not intended. And this ranges from persons who were perhaps surprisingly on vacation and were unable to come back home because of cancellation of flights, to persons who had work arrangements which have, of course, been cancelled or been terminated because of the circumstances globally, to interns whose internships have come to a close and students whose institutions have closed terms, in some cases with residences remaining open for them and in others not so much. Through our embassies, high commissions and consulates across 20 countries, we have done our very best, and in addition with our honorary consuls and our extremely important diaspora community or diaspora associations, been able to identify and provide support. Sometimes it's a conversation and counseling, as has been set up by an excellent team of pastors and counselors in Miami who reach out to our hotel workers and who were discussing how to engage more deeply with a broader set of persons who have found themselves in circumstances where they had not planned to be as a result of the global COVID-19 pandemic. Again, we have sought to ensure that we are able to provide, where possible, accommodation or foods where persons have accommodation provided by employers who are unfortunately not functioning anymore, but trying to assist our nationals because their arrangements have come to a close, as well as, of course, persons who have, through the grace of friendship, family, and community, been able to provide broader support for our nationals, whether it's medication, a safe place to stay, or resources and services. And for this, we are enormously, enormously grateful. We want to say, as Prime Minister said earlier, that we are absolutely in sympathy and empathy and understand the concerns that persons have about our nationals overseas, and also that being experienced by our nationals overseas. And it's true that there are no easy choices in these circumstances. There are only the best possible decisions with the public health of Jamaica in mind. In these circumstances, I know that the public has been broadly debating the 43 crew workers on the Marella Discovery 2 who are now docked in Southampton in UK, along with approximately, well, it's a group of approximately 90 cruise workers on about 6 ships that are docked in that port at this point in time. I want to assure you that we are in touch with all our stakeholders, including the owners of the cruise line, about arrangements to bring those 43 workers home, as well as an additional 73, as well as an additional 30 that have been identified as non-essential crew, which they therefore would not require to keep the mechanics and of the essential services of the ship together and functioning. So we have decided as a government that we will engage with the owners of the line to bring those persons home. This does, however, require the cruise line to undertake their obligations under the Maritime Labour Conventions, which guide not only Jamaica, but they guide the Bahamas, to which the Marella Discovery 2 is registered. And as signatory countries, we expect international law to be adhered to. There are meetings set as early as tomorrow morning between our High Commissioner as well as the chair of the JTB. We recognize that the cruise industry does not generally relate to the Foreign Affairs Ministry. Their key interlocutors are within the tourism sector. So Foreign Affairs have been working closely with the ministry and their agencies, the Ministry of Tourism and their agencies, to try to ensure that we get the best information and that we try to find the best solutions possible. So again, the arrangements that will be made for those workers will be in accordance with the protocols to which the Prime Minister made reference earlier. There will be a broader discussion, as Prime Minister has said, of the protocols as a whole, but we will keep you informed. We regretfully have not been in direct touch with the workers. We've been speaking with the organization, and you must understand that with thousands of workers overseas, it would be a difficult thing for us to manage as a government, direct and individual communication. So to try to ensure that we have the appropriate processes in place, clear and factual information at all times, our approach has been to liaise with the owners of the cruise lines. And just to give you a sense of where we are in terms of understanding where our Jamaicans are, because I feel sometimes that there's a sense that we have one small cohesive body of persons in a specific location, and this is not the case. we have 322 Jamaicans across 70 ships on one cruise line. We have 867 crew members on one cruise line across a number of ships, which we are seeking to confirm. We have 90 crew members on one line across 6 ships. We have 586 on another cruise line across 9 ships, and we have 128 across 4 ships, again in varying locations at sea, at different ports across the globe. So from a logistical perspective, from a communication perspective, and from a sheer capacity perspective, this is a hugely complex matter to consider in terms of repatriation. I know that there are references often to some countries sending planes for their citizens. Regretfully, Jamaica is not at an economic state and a state of airlift capacity to do this, and we're not alone. Many more countries than those which have sent have not been able to. This causes challenges, and as Prime Minister said, across the Caribbean, most of our brother and sister countries are in the same circumstance, although perhaps with different locations. I want to also add that we have been collating information about our non-cruise workers across the world. And at this point in time, we have in one cohort close to 350 persons identified who are seeking assistance across 30 countries. And that's not counting the hundreds in the US that are engaged directly with our embassy, and our consulates in New York and Miami. So again, we engage as much as we can, we provide support as much as we can, and we seek the best solutions as a government with capacity issues, which with changing circumstances, because of course, persons would recognize that even when we started to discuss the matter of controlled re-entry of our nationals overseas, we did not have yet the spike of the capacity that we have discussed today. We did not have the outbreak of more than 100 persons have been added to the list since then. And this means that there's increased capacity constraints on our health workers, on the quarantine locations that we may have been seeking to identify, as well as, of course, the general considerations of how they will be taken best care of when they return. So again, these are not easy issues, no easy choices, only the best possible decisions that can be made in our best interests as a country as a whole. We thank you for your patience, we thank you for your understanding, and we will be here to welcome you home as soon as we have the appropriate arrangements and capacity in place. This will clearly have to be a phased arrangement, and we will do our best to work with you to ensure the best solutions. I thank you.
Thank you, Minister Johnson-Smith. What we have been able to do with this matter is to bring the Ministry of National Security, Immigration, the Ministry of Tourism. Minister Bartlett is here. He has excellent relations with the cruise element, and they have been very forthcoming in what can be done to bring our Jamaicans home. And then the Ministry of Health to have the health protocols in place. It is not easy to coordinate this, but we have managed to get it done. We have developed an application, which we will launch this week, which will help to coordinate the thousands of Jamaicans all over who are seeking to come home. Bear in mind that our orders are still in place, that anyone who is allowed re-entry into Jamaica must serve a period of quarantine, 14 days. It will be up to the Ministry of Health to make an assessment as to whether or not the quarantine is at home or in a place appointed by the state. It is more than likely going to be a place appointed by the state. In fact, that is the recommendation. We're also saying that everyone who is allowed re-entry must be tested upon re-entry. So you can imagine the logistics in that. Then it has to be an end-to-end solution. It can't be that you just come home and you find your way to the place of quarantine. That doesn't make sense. So there has to be a logistics operation end-to-end, that you land in Jamaica, you're processed, and arrangements are made for your luggage and whatever you take back with you, and your physical self gets on a bus and you are transported to the appointed place for quarantine. There are other issues to consider that tomorrow I'm certain in Parliament they will raise. But I believe we have the logistics lined up. The problem now, and I say it is a problem because it is a real problem, is the capacity. Remember what I said earlier, that the Ministry of Health, the public health departments especially, they have been consumed in manning the centers of quarantine which are now operational, in manning those persons who we have in isolation. They are doing the contact tracing. Some of them are doing the testing. The truth is that we simply do not have enough personnel. Simply don't have enough. So if you're considering bringing home thousands of Jamaicans that have to be administered and processed and monitored and supervised in a process of quarantine, then that means the other functions that they are doing could be deprived. So it is a delicate balance. So I've asked the Ministry of Health to see how we can ramp up capacity, and they are developing a plan which they will present to me. So we're doing everything possible to bring home our Jamaicans. I'm going to ask the Attorney General to address some legal issues. Well, I couldn't say legal issues, but some claims for exemptions that have been made.
Thank you, Prime Minister. On Friday, April 17, the President of the Jamaica Bar Association brought to my attention a letter he wrote to the Minister with responsibility for national security, seeking exemptions for the legal profession. I note that there is a public debate raging, and there seems to be some dissonance between the request of the bar and other members of the profession. The matter has been considered. The request of the bar is a reasonable matter, reasonable request on 3 areas. It's in respect of duties to be performed which cannot remotely be performed, and the new order will reflect those modifications. Just to say that the existing order was done in consideration of the practice directions given by the Honorable Chief Justice and the President of the Court of Appeal. And so the emergency hearing matters are covered currently, but we appreciate the wider concern for matters which are not covered, but for which the attendance of an attorney would be required. Also, Prime Minister, there are other areas outside of what the bar has requested which fall for consideration, and the new order will so indicate. So, to members of the legal profession, there was no deliberate decision to exempt you, but bear in mind that we are containing movements, and we are also mindful of what you do and how your duties are impacted if you cannot move. So be assured, the matter is being dealt with.
All right, we're going to just look at a graph of where we are. So on your screen, you should be seeing a lovely graph. If I could get it to my screen. So you will see some solid lines and some broken lines. So the blue line is 12 is what we call the 12-day doubling curve. The yellow line is the 10-day doubling curve. And the red line was the 8-day doubling curve. The white dotted line are the number of cases, the cumulative number of cases each day. The green dotted line would be the number of cases, the cumulative number of cases each day without the current outbreak at the workplace facility. So let's start there. So you can see that the white dotted line is trending up at an increasing rate and with a very steep slope. This is almost approximating the 8-day doubling curve, meaning that the numbers, as it says, doubles every 8 days. Now, if you look at the outbreak starting from the 10th of March, we were tracking very well the 10-day curve fairly well. And in fact, we were moving towards a 12-day doubling, meaning a longer period of time before the doubling of cases. But now, with the new outbreak in the workplace in Portmore, we're tracking on an 8-day doubling, meaning we're going to have more cases more quickly than before. And I just wanted to point that out to persons, that the strategy that the government has to put in place now is to bend that curve, because now that curve is trending up, and we need to bend it back to the 12-day doubling curve, or even a greater number of days for doubling. For that to happen, strategy number one: if you don't have to move, don't move. If you don't have anything urgent or useful to do on the road, stay home. Work is urgent and useful, but let's do it smartly. So if you go to work, maintain social distance. Avoid gatherings of 10 or more. Wash your hands regularly, especially after a cough or a sneeze. If you have to sneeze, do it in the bend of your elbow. Wear a mask. If you are ill, I beg you, turn in your yard. In fact, lock up in your room by yourself. Isolate yourself from your family. Let the medical system know, let the health system know. And you can do this by going on to jamcovid19.moh.gov.jm and register yourself. Or you can call our 888 One Love number, or call our local health center, or have someone do it for you if you can't do it. If you have any kind of symptom, stay home in your room by yourself. Strategy number 3, which is a more long-term consideration, is that we have to reorganize the way in which Jamaica does business. Too much of our business has to be done in the physical presence. Too much of our business requires us to travel. When there are more convenient and cheaper and more efficient ways of doing business, we have to become a digital society. And the government already has measures in place, but now it is imperative that we move those measures forward. One simple thing that we can start to do is to, as Jamaicans, all Jamaicans, is to get yourself a bank account. That is the start of moving online. Now, I know it's difficult, very difficult, but I think the banks well understand, the government well understands that it is something that we have to promote. And in the coming weeks, you will hear of other measures that we are putting in place to ensure that we can move onto digital platforms to conduct financial transactions and pay bills, which a large number of Jamaicans are already doing. But the truth is that too many Jamaicans are not doing it. They still have to stand in line to collect their PATH benefits and their pension checks. They still have to go and stand in line to pay their utility bills and all the other bills, when all of those could be done seamlessly, efficiently, and without travel online. So we're open for questions.
Thank you so much, Mr. Prime Minister. There are several questions. Let's get straight to them then on our Zoom with our media partners. First question, hand up, coming from Dion Jackson Miller of the RJR Group. I'm sorry, could you unmute your mic for us, Dion, and go ahead? We're still not hearing you. All right, let's try this again.
Okay,
Dion.
yes, thank you so much. Thank you so much, Naomi. Mr. Prime Minister, I'm not hearing you take responsibility for the chaos that ensued in St. Catherine, which was not just entirely predictable, but which was predicted by many people who said 2 shopping days were grossly inadequate. The government made a small adjustment to the hours, but added no days between Wednesday and Saturday, therefore exposing the residents to not just distress, but crowds and the possibility of infection. So my questions are, was this lack of foresight caused by deficiencies in the technical recommendations, or did Cabinet override the recommendations made? 2, who are you adding to your team who has more experience in logistics and planning so that we don't experience anything like this going forward? 3, your Minister of Education, the ministry says online school starts Wednesday. Given the widespread problems accessing internet at home, when is the government planning to acknowledge that this term has been lost? And 4, how many of the new cases were symptomatic?
Well, let me start with the education system. The Minister Samuda is not here. I had a discussion with him. There is no lost term. I know that education is taking place in the country. We also know that there are areas that are not served by the internet or access to other remote methods. And we are working with great speed and alacrity to have that done. In fact, you would have heard me speak about the transition to a digital society and moving that much more quickly than we are now. A part of that is to build out the infrastructure to do so. And in my next press conference, you will hear more plans which we have in place to build out that infrastructure. So I'm not prepared to concede any loss of a term. It appears to me that there are those who would want to hear some bad news. I am not going to be the bearer of that. Now, as it relates to what happened on the weekend in Portmore, it was always known that there would be crowds. In fact, every measure that we have put in place, not just for Portmore, but generally, that when those measures are put in place, that there is an excess of persons taking what I consider to be precautionary measures in shopping. At least 20% of persons who turned up were shopping out of precaution, meaning that somehow there is a level of panic that is in their minds that somehow the place will be shut down and for weeks they will not be able to access the supermarket. Granted, that has not been the experience because that has not been what the government has done. However, the level of panic that is created by the purveyors of falsehood and fake news and those who want to see negative things happen has heightened that. Now, if persons followed the regular shopping trend, yes, there would be a crowd, but not to the extent that we saw. The second point is that we monitored almost hourly what was happening in Portmore. And yes, there were crowds, but there were no riots. And in any other shopping day, for those who know, for example, Linstead, the crowds there were no different. Or in Spanish Town, were no different. In Portmore, granted, in some areas, there were more crowds. Again, what would have caused that? The precautionary buying. I want to take this opportunity to say to Jamaicans, there is absolutely no need for panic. The society is going through a reconfiguration of how we do business and how we live in order that we can survive. The government has no intention whatsoever to deprive you of your livelihood, of your food, of your medicine, and all the essentials and necessary things of life. The government is doing everything possible to ensure that you can go about your life without becoming a victim of the SARS-CoV-2 virus and the COVID-19 disease. This requires sacrifice on the part of every Jamaican, but more so, it requires us to be smart, and it requires us to filter out negative information, false information, and those who would seek to create mischief, and focus on what the government has said is appropriate. I personally went out to Portmore, as I have done in other areas where we have taken measures, to see what was happening for myself. And it was clear that by 5 p.m., the crowds had subsided. So there were 3 clear shopping hours where shopping could have gone on. I say to those persons who would seek to cast doubt on the government's ability to plan, we have been very inclusive. Between myself, the Minister of Health, the Minister of National Security, the Minister of Foreign Affairs and Foreign Trade, the Minister of Local Government, the Attorney General, the Minister of Tourism, all the ministers have drafted in the capacity and resources of this country in a collaborative and participatory way to provide the solutions. Even up to the last minute of the drafting of the instructions, persons were calling in, giving advice. The majority of Jamaicans know that they have a listening government, and a government that is responsive. And I will always respond. I don't claim to be infallible. I don't claim to not being a human who could make mistakes. But I take my job very seriously, and I'm very diligent, and I reject strongly any claims by anyone who would seek to cast doubt and spread negatives on the efforts of the government and the people of Jamaica.
Sorry, there was a question concerning the numbers.
CMO?
Yes.
Good evening, everyone. Thank you for your question. However, I want persons to understand that we do get these results. When we announce them today, this evening, we would have gotten these results between last night and this morning. And so we would not have gotten all the information in terms of all the details of the cases. So I wouldn't be able to tell you how many persons were symptomatic versus asymptomatic. What I can tell you, though, is that the timing of the testing, and based on where we've seen the onset of symptoms for the majority of persons, it would appear that at this point we would be at a point where we'd be seeing that most persons would be right in the middle of an incubation period. And so therefore you may have very, very early symptoms. Most persons would be in a pre-symptomatic phase, and then you would have persons who would be start showing symptoms at this time. But I don't have the information on the numbers right now.
Thank you so much, CMO. Based on the hands raised on our Zoom call, Brittany Clark from Nationwide is next. Brittany?
All right, so I have two quick questions, please. Firstly, regarding the order that the BPOs have been ordered closed effective Wednesday at midnight, just to clarify.
I'm sorry, Brittany. We didn't hear very well on this side. Could you repeat that question for us?
Okay, sure. Okay, so regarding the order that the BPOs have been ordered closed effective Wednesday at midnight, just for clarification, does this order apply to BPOs where all staffers are working from home, or is it only for the closure of the physical BPO space? And the second question, is it confirmed that the deportees will be accepted into the island tomorrow as previously announced? And if yes, what are the plans for them? Thank you.
So the BPO close, so let's be clear, the intention is not to punish the good for the bad. The intention is not to deprive people of their livelihoods. The intention, as I have said before, is to provide a space where we can reconfigure the operations of the BPO. What is clear to us, the lesson learned from the workplace in St. Catherine, is that in a closed area with a concentrated number of workers in close quarters, the disease can spread rapidly. Now, from a public health standpoint, you don't want any kind of infection to be spreading. The age profile of the persons in the BPO would not be considered the high-risk age profile. There might be still some high-risk persons there with comorbidities, but they are not of that age group. The challenge, however, as the minister pointed out, is that they live in what is called multi-generational arrangements. So they live in a household with their mother and possibly their grandmother. It is that transmission for which we are concerned. Now, if it were to happen in another BPO, then you could see how that would have an impact on the national numbers, but also on the national spread. So what we want to do, what we have done, is those persons that we have identified from that workplace, we're going to quarantine them in one place where we can have control over them. Where there are other BPO type operations, we are going to put in place measures to address them. We're going to announce those soon. But the BPOs, the ones that we know of, the ones that we regulate, those we are saying 14 days, close the operations, that is the operations of the facility, minimize to the bare minimum what is necessary to keep your servers up, keep the critical services up, which I mentioned before, like the telecommunications, which we all need and benefit from. Were that to go down, then you could really have a major problem. The logistics for shipping for us to get our stuff here. And many of our BPOs serve not just Jamaica's logistics, but global logistics, of which we are a part. So those minimum operations, just to keep those going. But everything else, they have to migrate it to a different place. So they can migrate to homes, which I've said, of the 40,000 people who work in the sector, 13,000 have migrated to working in homes. They are now trying to make arrangements with hotels. That might be a challenge, but I am making an appeal here to the hotel sector. No business is happening in hotels now. Here is a perfect economic opportunity to put hotels and BPO operations together. And I think that is an opportunity that should be explored because it is in the national interest and it makes good business sense. So the BPOs will significantly reduce their operations to the point where you could literally say they have closed for the 14 days. In that 14 days, they have an opportunity to restructure, many of them to deep clean, many of them to rethink their operations, and it breaks any possible contagion link that may be developing for which we do not know.
Thank you, sir. Let's go to...
And the CMO would like to add to that.
I just wanted to go back a little bit to the question from Dion. I think that this cluster of cases that we have from the BPO gives Jamaica a unique opportunity to be able to track the onset of symptoms. And we won't lose this opportunity because this is an emerging situation, and different countries are looking at their own case studies. And this is an opportunity for us really to be able to track onset of symptoms when it is that they do occur, especially in this subgroup, which is a different age group and has its own characteristics from the general population. So I think going forward, I mean, as we investigate and in our attempt now to take out these persons from their homes and put them in a controlled setting where we can monitor them, it gives us really an opportunity to share the information that we will learn from this experience with the rest of the world that will also help other persons to decide on the management of persons and how it is that they monitor.
Thank you, CMO. Let's move to Damien Mitchell from the Gleaner Company.
Thank you very much. Prime Minister, on April 7th, the Health Minister reported that about 1,000 people who arrived in Jamaica between March 18 and 24 had still not made contact with his ministry as mandated by the order. How many of those 1,000 people have since been found, and how many are still being pursued for prosecution? That's question one. To the CMO, can you confirm whether there was in fact a 6th COVID death involving a retired lecturer? And if Minister Johnson-Smith could help me here, what exactly are the obligations of the cruise lines that must be met for these ship workers to return home? And while you're at it, Minister Johnson-Smith, can you say whether the authorities had received the temperature log of the workers aboard the Marina Discovery 2? If so, when, and what was done with that information?
I'm going to ask the CMO and the Minister if they choose to answer your first question. The Minister of Foreign Affairs is on her way.
Yes, I can confirm the death of the university lecturer, and it's with a deep sense of my own, sympathies, both to the family that I know personally, and for Professor who taught me when I was in university. It is really very with great sorrow that we see, that we note his passing. And my condolences to the family, to the entire university fraternity, who I know have suffered a great loss. With regards to the numbers, we're trying to get an update where that is concerned, but I do know that the majority of persons, and we would have closed that gap in terms of the 1,000 persons that were outstanding, because there were quite a few persons that not only called in to the portals that we had established in terms of the website and the telephone call centers, but also directly into the health department as well. And what was the third?
The numbers.
We've closed the gap. I've said that we've closed the gap, but I'm not sure of the exact number.
Okay. All right, thank you, CMO. Minister Johnson-Smith. She's approaching the lectern.
Okay, let me start with the answer to your last question. I actually did not have that information in the brief that I received, so I'm not aware whether the temperature logs were received and what they said, but I'm sure that can be researched through Port Health or other relevant authorities. So that could be pursued if it remains of interest to you. Regarding the obligations of TUI or of the owner, these are under the Maritime Labour Convention 2006, which defines the status of seafarers, and it defines them as including crew working in the hospitality division of passenger ships, etc. And it states essentially that they have the right to be repatriated at no cost to themselves in certain circumstances, and essentially that this is the obligation of the ship owner. I know that there was a matter being discussed in the public domain in relation to an undertaking where TUI repatriated several UK citizens back to Britain in mid-March, and I think that there was a misunderstanding because those persons thought that it was the government that was repatriating them. It was in fact TUI that was paying for and providing for and undertaking a repatriation of their passengers, supported logistically by the British High Commission here, and of course the Jamaican government supported where it was appropriate and necessary to ensure the relevant laws and arrangements were adhered to. I hope that's helpful.
Thank you, Minister. I have a few from Facebook. We have a few from Zoom as well, but just for clarification, Prime Minister, there are several residents in Portmore especially who are asking the extension of the 24-hour curfew in Portmore. How long did you say
7
it
days.
was?
7 days.
7 days, everyone. And two, concerning the opening of Western unions and money agencies.
Yes, we have decided that on the shopping days, which I will go over before we close, but on the shopping days, the the remittance agents and financial aid agencies, banks, can open on the shopping days. And the post, yes, and the post office, of course, yes.
So that's banks, remittance agencies, and post offices can open. Let's then go to Mr. Edmund Campbell from the Gleaner as well. I'm sorry, you'd have to unmute your mic, Edmund. We're seeing you, not hearing you.
Are you hearing now?
We are hearing very well. Thank you. Go ahead, please.
All right, very well. What is the earliest possible time we can begin to bring Jamaicans home, including those, the crew members on the Marella? That's one. Are there any other person or persons from the Ministry of Health who have tested positive for COVID? That is in light of the single person who was reported earlier. And has there been any coronavirus infection at any BPO besides the Portmore Allery call center?
So the Minister of Foreign Affairs is on alert to answer your question if I can't answer it. The Cabinet has discussed it. We have a subcommittee of Cabinet that is working. We have not settled on a date. It is capacity determined. So I need to get from the Ministry of Health how soon they can build up their capacity in order to service any mass re-entry, mass-controlled re-entry of Jamaicans back to their home country. That will take some time. I can't say when, and I don't want to give any date to which I'll be held, but we are working as much as we can to get it done. Who knows? You could see some re-entry start, in the near future, but it all depends on our capacity, which we are trying to expand by doing some rapid training at this point. The other issue was Minister of Health will answer.
So the two questions, as I understand it, was whether or not there are other members of the Ministry of Health and Wellness testing positive. I'm assuming it means members who are at the head office, because as you recall, there was a nurse who is a member of the fraternity in one parish that tested positive. So we have done a number of tests. My understanding is that we have not yet gotten all the results, and so I'd prefer not to comment definitively on that until maybe tomorrow when we should be in a position to give a more definite position as it relates to the status of those who were tested. What I can say is that we've done the contact tracing of the individual who was tested positive. We had closed down all the offices in the New Kingston area, the place where he visited most, and one facility just outside of New Kingston. And we have done all the deep cleaning and so on that is necessary. So all of that has taken place and is taking place, and a number of tests were administered, and we should have some results by tomorrow or so. As it relates to the other BPO facility, is there?
With regards to one other BPO facility, we really have done some what we call an opportunity sampling of quite a few persons, just as persons that are workers there. We haven't gotten back those results as well as yet. And in terms of the other BPO facility that had closed, there was a contact from the Alarica call center. That person has been tested, and we're waiting for the result.
And as we are on testing and results on the health sector, on Friday, you may have noticed that we did not have our usual press briefing. That is because we all got tested. All the cabinet members got tested, and a few of our permanent secretaries took advantage of that opportunity. We put in place measures at the Cabinet Office, the OPM, and all ministers have been directed to ensure that the measures that they have in place are tightened in the ministry and around their personal security, in health security that is. We took some time to reflect on our own circumstances and operation to ensure the continuation of government in a time of epidemic.
All right.
By the way, so the results, we've got back the results, all negative.
I think that was the next question. Thank you, sir. It's 7:47, so let's take our final two questions. I will ask Ms. Zara Burton from 18 Degrees North, and I have a few online that are chomping at the bits. Zara, go ahead, please. I'm sorry, could you speak up a little bit? We're hearing you very faintly. Go ahead.
Could you articulate why, in the first instance, the BPO employees were considered to be essential workers? That's one question. And why now there are several that are still going to be allowed to stay open? Question is, how many BPOs will be allowed to stay open? I think Minister Tufton mentioned there were 68 in total. How many are going to be allowed to stay open under this exemption? And I know you mentioned 13,000 of them are now working from home. The Minister Tufton had said 10,000 have been working from home, of 40,000 at the time of the last press conference. Now you've mentioned 13,000. Doesn't seem like that's a big increase. Can you just explain what is going on there and why not more of these BPOs are working from home? And then the final question is, what about factories? I know you mentioned that there were things that were going to be evaluated. Are you going to be looking at factories? Have any factories come to your attention so far, just in general, about their working conditions and their social distancing measures?
So I didn't get to hear the first part of your question regarding BPOs and essential workers. The term essential worker has a legal classification to it, so I try to avoid using it. Because what we have done is, under the curfew orders, we have created some categories of exemptions. So BPO workers were exempted, and the reason is that there are some services that really cannot be shut down, because shutting those services down literally would shut down all other services that rely on them. So you have some operations, I'm not speaking specifically about BPOs, that are data centers. Okay? If data centers go down, you know, the knock-on effect is incalculable. So those have to remain up and those have to be manned. In the banking sector, you have some IT services that must stay up. If the banking sector goes down, the knock-on effect is incalculable. Those were not necessarily classified as essential, but the truth is that in the current configuration of technology and how our society works,